before starting with the topic, it is very important for us to know about rhesus factor. In the previous sessions also we have discussed about the ABO blood grouping system and the RH blood grouping system. So the RH blood grouping system or the rhesus factor is the one that gives the blood group its characteristic type, that is either the blood group is positive or negative. And when we look into the aspect of compatibility, then also we know that only the positive blood group is compatible with positive and the negative blood group is compatible with negative. And if in case both of these blood groups, both of these type of blood get mixed, for example, if the negative blood group gets mixed with the positive one, then this may lead to the production of antibodies, and this is known as RH incompatibility. So on this basis only, erythroblastosis fetalis, this topic can be understood. So when we are talking about the state of pregnancy, so what will happen if the mother is having negative blood group but the fetus is having positive blood group? Or what if during the intrauterine life the blood of both of them gets mixed? So this RH incompatibility will lead to an immune response in the mother that is known as RH sensitization. So whenever we are talking about the topic erythroblastosis fetalis, we must be very clear that this will happen in case if the mother is having RH negative blood group and the child or the fetus is having RH positive blood group. Then only there is the case, there are the chances of RH incompatibility. Although the chances for mixing of the blood are very low, but mixing may occur in a few cases, such as when the placenta is detaching from the wall of the uterus during delivery, or if there is bleeding during pregnancy, or during the manual rotation of the breech baby. If the presentation is breech, then if we are manually rotating the baby, then there may be chances of mixing of blood, or in case of abortion, in case of ectopic pregnancy, in case of miscarriage, or if there is a fall, blunt trauma or invasive prenatal testing, then there can be the chances of mixing of blood of the mother with the fetus. The other prenatal tests such as amniocentesis or chorionic villus sampling may also lead to the mixing of the blood. And if the mixing occurs, then what will happen? So in this case, we have to remember that the blood group of the mother is negative and the blood group of the fetus is positive. So if both of these blood get mixed due to any cause that we have already seen in the previous slide, the person with the RH negative blood, here the person with the RH negative blood is the mother. The person with the RH negative blood will produce antibodies to fight any future exposure to RH positive blood. Once sensitized, the body's immune system will recognize any future RH positive cells as foreign and attack them. So, if the blood gets mixed, then the body of the mother will produce antibodies against RH positive blood. So, in future, if there is any encounter with the RH positive blood again, then this will attack the RH positive blood RBCs. And if the RH positive blood from the fetus gets into the bloodstream of the women with sensitized RH negative blood, the women's immune system will attack the invading cells and will destroy them. And this condition is known as erythroblastosis fetalis. Destruction of RBCs is rapid in fetus, due to which the fetus will not get enough oxygen, and this will lead to anemia and other illnesses and eventually may lead to death. So if the antibodies are produced in the mother against the RBCs of the fetus, then what will happen? These antibodies will destroy the RBCs And if the RBCs will get destroyed, then the fetus will not be able to get enough oxygen, and if not getting enough oxygen, then eventually this will lead to anemia, other illnesses, and may lead to death of the fetus also. And if there will be excessive destruction of RBCs, so the organs that are responsible for the production of RBCs, those are liver and spleen. They'll work faster and will try to produce more and more of the RBCs and will bring them into circulation. And as they have to fulfill the demand, so they will bring immature RBCs in the circulation due to the rapid production. And this condition will lead to excessive workload on the two organs, those are liver and spleen. And whenever if any organ of the body is performing excessively more than its capacity, then it leads to the enlargement of the organ, and enlargement is termed as megaly. So this will lead to hepatomegaly and splenomegaly. So the immature RBCs will also break down faster because they are not strong enough to complete their whole lifespan, which is of 120 days. So they will break down faster, leading to more and more production of bilirubin. And this condition is known as neonatal jaundice. Excessive bilirubin in the blood is known as jaundice. So this will lead to neonatal jaundice. So the complications due to this condition, due to this RH incompatibility, the complications can be hepatomegaly, splenomegaly, jaundice, and mild to severe anemia. And it is also important to know that this condition mainly affects the second fetus, because for example, if there is mixing of the blood during delivery, so the first child will come out safely, but the next time when the mother gets pregnant, then and if the fetus is having RH positive blood, then because of the previous pregnancy, the mother has already developed antibodies against the RH positive blood type, and the second time when she gets pregnant, then those antibodies will fight and destroy the RBCs of the second fetus. So this condition is mainly affecting the second fetus. Mother gets RH sensitized due to the mixing of blood during her first pregnancy. So the second time she conceives with a RH positive fetus, her blood that is already having antibodies against RH positive blood, this will result into RH incompatibility with her second fetus. But this condition can be prevented. There is a medication, there is an injection that is known as RH immunoglobulin, also known as RHOGAM, that can prevent RH sensitization. This medication prevents the pregnant women from developing RH positive antibodies. This injection is also commonly known as anti-D injection, that is usually used in the hospital settings and is given intramuscularly. So this is the anti-D immunoglobulin injection that is monoclonal in nature, and it comes in 300 mcg of dosage. It is a liquid injection that is given IM. So when to take RH immunoglobulin? First dose of RH immunoglobulin or anti-D injection is taken at 28 weeks of gestation. See, if the mother is having RH negative blood type, then first thing that we have to do as soon as the fetus is viable, we have to take the blood sample of the fetus and check what is the blood group. If the blood group is negative and the mother's blood group is also negative, then there is nothing to worry. But if the blood group of the fetus is positive, then the first dosage of RH immunoglobulin or anti-D injection is given at 28 weeks of gestation. Or we have to give the injection after 72 hours following delivery if the newborn is RH positive. Then within 72 hours of miscarriage, abortion or ectopic pregnancy also we have to give the RH immunoglobulin to the mother. Then after following an invasive prenatal test such as amniocentesis or CVS also we have to give the injection. Then after any vaginal bleeding also we have to give RH immunoglobulin. Now comes the dosage. Following the delivery of an alive baby, and if the newborn is having Rh positive blood group, then we have to give 300 mcg of anti-D injection IM. And if the mother has suffered with an abortion, miscarriage or ectopic pregnancy, then the dosage is halved to 150 mcg, and this is also given as IM. So this was about the condition erythroblastosis fetalis and its prevention. So what we need to do is we have to be aware about the blood group, about the type of the blood, and accordingly we have to see that what we need to do and how we need to prevent this situation.